How obesity can lead to diabetes and high blood pressure. Most people think of obesity as simply carrying too much weight. But the bigger problem is what that extra body fat can start doing inside the body. Because fat tissue isn't just storage, it's biologically active. And as fat cells, especially those around the abdomen, become larger, they can release signals that promote inflammation and interfere with the way your body handles insulin. Normally, insulin acts like a key. After you eat, glucose enters your bloodstream. Insulin tells muscle, fat, and liver cells to take that glucose in and use it or store it for later. But with insulin resistance, those cells stop responding as effectively. The pancreas reacts by producing more insulin. For a while, that can keep blood glucose under control. But if the resistance continues, the pancreas may eventually struggle to keep up. Glucose starts accumulating in the blood. Prediabetes can appear. And in some people, this eventually progresses to type 2 diabetes. But that's only one side of the story. Excess body fat can also push blood pressure upward. Several systems become involved. The sympathetic nervous system, essentially part of the body's accelerator, can become more active. Hormonal systems that regulate blood pressure and fluid balance can also become overactivated. And the kidneys may retain more sodium and water. More retained fluid means more volume circulating through the bloodstream. At the same time, inflammation and metabolic abnormalities can affect how well blood vessels function. The result? The heart has to pump against increasing resistance, and over time, blood pressure can remain chronically elevated. So obesity, diabetes, and hypertension aren't three completely separate problems. They can become part of the same interconnected metabolic process. Excess fat contributes to insulin resistance. Insulin resistance increases the risk of type 2 diabetes, and many of the same metabolic, hormonal, and kidney changes can contribute to hypertension. But there's an important detail. Obesity does not mean that someone will inevitably develop diabetes or hypertension. Genetics, fat distribution, age, physical activity, diet, and many other factors influence individual risk. What obesity does is shift the odds, and understanding what's happening beneath the surface explains why managing excess body fat isn't simply about appearance.